My name is Cotrufo and I'm a plastic surgeon in central London, Harley Street. This is a video about the consultation process, which I think is an essential step in the decision making before proceeding with any surgery. During the first stage of the consultation, I go through a very thorough collection of the medical history. So usually during that time, I ask my patients to tell me everything that was ever relevant during their medical history since childhood, including those things that are not considered to be necessarily relevant to the very reason why they're attending my clinic on that day. Most people don't know that some incidents like allergic reactions or injuries to the spine during birth can have a very serious consequences when they're having a surgical procedure which involves the manipulation of the spine, for example, or the prescription of medications that will be administered to them before or after surgery, either by mouth or intravenously. The next step will be based on asking patients what are the main concerns with regard to one or two anatomical areas, because very often I'm able to combine procedures as long as it is safe and technically reasonable. I like to perform the whole examination in front of the mirror, and this is because I think you might find it interesting to see what I see. And so you can also observe the technical maneuvers that I perform to examine and manipulate each anatomical area. For those that are attending for a body examination, then they offer a chaperone that will be assisting throughout the whole process. And this option is also recorded in their clinical notes. For those that instead are attending for facial plastic surgery, like a facelifting, a rhinoplasty, or eyelid surgery, then they're asked to remove their makeup before seeing me, and this usually happens in a reception on their arrival. The next step is the explanation of all the possible technical options that are available to you in order to treat that one specific anatomical area. A good example could be the rhinoplasty surgery. For example, it is possible to perform a rhinoplasty using so many technicalities with regards to cartilage manipulation, cartilage grafting, bone grafting, and osteotomies, and obviously combining all of them. So it is very important to go through the pros and cons of each one independent step that can be useful in order to give you the best possible outcome. The same concept can be applied to any surgical procedure you may think of. And so if we talk about breast lifting, abdominoplasty, liposuction, facelifting, for each one of those procedures, it's possible to reach the target using so many different techniques. It is very important to me that you understand very clearly what are the pros and cons of each technical variation before you confirm your choice. So far, I've learned that combining procedures, addressing tissues layer by layer, and looking at the areas that are immediately contiguous to the one that we are targeting to start with are the key to achieve the highest satisfaction. This concept can be applied to all anatomical areas. So, for example, more and more patients are attending my clinic in order to have a facelifting. That's because they feel more comfortable about the excellent outcome that we can achieve with the plane approach as described by Dr. Giacono in New York City, who is also my teacher. When I do consult those patients, then I need to be very careful in understanding if there is an elongation of the upper lip or an aging of the lower eyelid, for example, as those subunits will have to be addressed at the same time of the facelifting, otherwise they might become more obvious after the primary procedure. Another example that is very common in my practice is the liposuction of the back area, where I'm very comfortable in achieving excellent results and very smooth contouring over the most difficult brow rolls, thanks to the combination of technologies, including the ultrasound assisted, the power assisted, and the radiofrequency liposuction. Also in those cases, proportion is everything, and so being in front of the mirror is so useful to both myself and my patients in order to understand how reduction of the back will have an impact on the surrounding areas, more often the arms and the abdominal wall. And so the conclusion is that they should be treated at the same time, or otherwise they might look larger than they did before surgery. The good news here is that there is no harm in proceeding stages, in particular if you are not sure about operating on that additional anatomical segment. In my case specifically, I think that if we are using the fat to augment or rejuvenate any other anatomical segment, for example the buttock or the breast, well, it is always good to have the chance of performing stage 2 in order to refine our outcome. The last stage of the consultation is based on clarifying other crucial aspects, such as the recovery time, the type of anesthesia, the complications that I'm more concerned about, but also the limits that might be related to a specific body habit or facial features. By the end of the first visit, I like to reassure you by saying that the beauty of the first consultation is that we don't need to take any decisions today. So, by the time you arrive home, you receive an email that will include essential documents for you to read, such as the consent form, instructions on what to do before and after surgery, and obviously the fees for your surgery. Once you're ready to go ahead, you will be invited to come and see me again for a second consultation, which will be free of charge. And during that stage, you will go back in front of the mirror and repeat the conversation we had before. We will challenge it so that we can make sure that our technical plan is clear, safe, and sound. I believe that attending your consultation with either a friend or a member of your family is a great idea, because this will give you the chance to have a conversation about your consultation without the risk of being lost in translations. Nevertheless, I will be very clear with them since the very beginning in asking them not to intervene during your consultation. So I want to hear the answers directly from yourself. Simply because I need to understand how you feel about your concern and what exactly you wish to achieve, and obviously respecting the fact that you will be the one taking all the risks and taking the time off for healing and obviously all the expenses from the surgery. When you decide to go ahead with your plastic surgery procedure, it is crucial that you have the full support of the people you live with, but also of those members of family that are most relevant to you. This is mainly for two reasons. The first one is that after surgery, in the first few days after you go back home, you might need some assistance and some nursing. The second is that if anything had to go wrong, like for example, you're not completely satisfied with the outcome, or if there is a complication, then in those cases, more than anything else, you need to be surrounded by a very loving environment rather than by an hostile one. In other words, my advice is that you don't want to find yourself on one side dealing with a complication and at the same time be surrounded by people saying, "I told you not to go ahead." I'm Dr. Stefano Cotrufo. I'm a specialist in plastic surgery operating in central London. Thank you very much for watching this video. I hope you find it useful. And please don't forget to follow me on Instagram in case you wish to know more about my plastic surgery service, and in particular if you wish to see my results, which of course I'm very proud of.